Welcome to this explainer. So have you ever stared at that glowing screen in your vet's office, kind of just nodding along while they point at a blurry blob of gray and white? And you're secretly wondering, how on earth do they actually see a problem in that? Well, today, we're going to completely demystify that process. We're going to learn exactly how veterinarians decode the complex visual puzzle of your pet's x-rays, turning those shadowy, overlapping images into a true veterinary detective story.
But before we reveal the answers and dig into some actual clinical cases, ask yourself, what do you think doctors are actually looking for in these blurry black and white images? I mean, are they just looking for obviously broken bones? Or is there a deeper, much more systematic language hidden in those shadows? Keep that in the back of your mind as we build up our diagnostic toolkit today.
Section 1. The Art of Interpretation, Setting the Baseline.
Okay, let's just dive right in by understanding what radiographic interpretation actually means in a real-world clinical setting. You know, it's really easy to assume that taking an X-ray is just like snapping a photograph on your phone, right? But interpreting it is an entirely different art form. It requires setting a very strict baseline of knowledge. It's not just looking at a picture, it's the strict translation of visual clues into a concrete medical explanation of an underlying disease. Basically, it's about connecting the shadow you're seeing on the screen to the biological malfunction happening inside the animal.
And here is a huge, absolutely crucial takeaway. An instant diagnosis is a total trap. The medical literature reminds us over and over that radiography is not an absolute diagnostic tool, but only an adjunct to clinical diagnosis. Why is that? Well, because entirely different diseases can actually produce the exact same radiological shadows. A dark spot might just be trapped gas, or it might be a highly destructive lesion. You simply cannot know for sure without pairing the image with the living, breathing patient sitting right in front of you.
Section 2. The Diagnostic Toolkit, Rules of Engagement. Now that we know what we're doing, and more importantly what traps to avoid, let's establish the medical detective's rules for reading the scene. Because you can't just hold an X-ray up to a ceiling light and expect to see the subtle clues. To do this correctly, there are strict rules of engagement. First, you must view the film on an illuminator fitted with fluorescent light, just so all parts of the film receive a similar intensity. Then, examine the fine details minutely before jumping straight to the gross lesions. Our human eyes naturally gravitate to the biggest, most obvious abnormality, but you really have to force yourself to look at the fine details first. Avoid that instant diagnosis, and always ensure a complete systematic evaluation.
So what does a complete evaluation actually look like in practice? You need to systematically step through these 5 factors. Step 1, evaluate the patient's history. Context is literally everything. Step 2, use that proper viewing box we just talked about. Step 3, perform a distant evaluation of the X-ray. Actually stepping back helps you see the overall proportions and gross symmetry before you zoom in and get lost in the weeds. Step 4, carefully assess the identified abnormality itself. And finally, Step 5, assess the duration of the lesion. Is this an acute, sudden injury, or something chronic that's been quietly changing the tissue over months?
Section 3. Examining the esophagus. Spot the difference.
Let's crack open our first case file to see exactly how a trained eye spots severe pathology. We're going to start by examining the esophagus. Take a really close look at these 2 comparisons. Notice the dark space and see if you can spot the staggering difference. Up at the top, we have a perfectly normal esophagus. It's tight, it blends in, and it's doing its job moving food to the stomach without drawing any attention to itself. But look down below. Do you see that vastly expanded, air-filled, mottled space taking up a huge chunk of the chest cavity? That is a condition called megaesophagus. The structure has massively dilated. And honestly, once you know what the normal, practically invisible esophagus looks like, this massive pathology becomes completely impossible to unsee.
Section 4. Evaluating the heart by the numbers. Our detective work gets even more precise when we look at the heart, which relies heavily on rigid proportional rules and really careful measurements. Unlike the esophagus, which we mostly want to remain unseen, the heart is always going to be prominent. As a general rule, the heart should take up about 2/3 the height of the thorax, but the real magic number for width is exactly 50%. The heart should take up roughly 50% of the width of the thorax. Plus, if you're looking at a lateral view, meaning a view from the side, the heart should span roughly from the 3rd intercostal space right to the 4th or 5th. It's a very specific, mathematically measurable piece of anatomical real estate. But you know, there's always a trick, right? The rules totally change depending on the patient. Veterinary medicine is uniquely tricky like that. For larger dogs, the heart can actually comprise up to 70% of the thorax's height. You constantly have to adjust your baseline expectations and proportional rules based on the specific size and breed of the animal you're evaluating. Keeping those precise measurements in mind, check out this visual comparison. Up top is a normal heart, fitting perfectly within those standard intercostal boundaries we just talked about. Down below, that's a clear case of cardiomegaly, an enlarged heart. Honestly, you don't even need a ruler to see that the heart in that bottom view is enlarged well beyond the standard boundaries. It's taking up far more of the thoracic cavity than that strict 50% width rule would ever allow.
Now, what happens when the problem isn't just an enlarged muscle, but rather fluid? This right here is what happens when fluid builds up completely around the heart, a condition called hydropericardium with pericardial effusion. Look at how drastically the heart's normally crisp, distinct silhouette has been altered. The fluid creates this massive, uniform, almost balloon-like shape that completely obscures the specific chambers of the heart. Those sharp, readable edges, they're just completely lost in the shadow.
Section 5. Lungs and the abdomen, mapping the shadows. Let's round out our anatomical tour by evaluating the remaining space. The abdomen can easily be one of the trickiest areas to decode just because so many organs are layered together. But first, let's quickly look at the lungs. Normal lung tissue has a subtle, structured pattern to it. Can you spot the difference in the bottom view? The normal lung structure completely gives way to an abnormal, starkly dark void of air in the chest cavity. This anomaly is known as pneumothorax. Basically, free air is filling up that space where lung tissue should be, completely changing the overall contrast of the radiograph.
Now, to really decode the belly, we use this normal abdomen map to orient ourselves. And here's an amazing, kind of hidden medical secret. The abdomen relies heavily on the fat between organs to provide visual contrast. We check the typical sizes and placements of the stomach near the top, the liver tucked in right there, the kidneys, and the looping large and small intestines. We're mapping these against that surrounding fat just to ensure everything is exactly where it belongs.
Once we know what that normal abdominal map looks like, the pathology just leaps right out at us. Just look at this. That massive, opaque area dominating the space is an enlarged liver. This is a textbook presentation of hepatomegaly. It is so absolutely massive that it's literally pushing the other organs completely out of the way, shifting the entire geography of the abdomen. That subtle map we just learned, totally taken over by this swollen organ.
We've definitely covered a lot of ground today, from the strict rules of systematic evaluation to spotting a ballooning heart and mapping out the complex abdomen. So the next time you're at the clinic and the vet pulls up a radiograph, I hope you remember the incredible detective work involved. Don't just see a blurry picture anymore. Ask yourself, what hidden clues might be lurking in those black and white shadows? And see if you can spot the story they're trying to tell.